content is not a substitute of professional medical advice, diagnosis, or treatment. Always seek the advice of a physician for any questions you may have regarding a medical condition. Hello and namaste. It's me, Sarbin Nepal.
And it's me, Suman Kumar.
First of all, I would like to welcome you all to yet another episode of our podcast, brought to you by Creative Callosum Nepal. In this program, we'll be discussing various diseases that we have encountered during our clinical postings. Without further delay, let's move on to our today's scenario.
A 8-year-old boy came to our hospital with a history of single episode of nasal bleeding after being hit by a football while playing. The bleeding was profuse, bright red with no clots, bilateral in origin through anterior nasal septum. After being admitted, he underwent a series of investigations. So based on this history, what do you think might be the possible diagnosis?
Based on the history, the provisional diagnosis can be traumatic nosebleed, while other possibilities like nosebleed due to picking up nose, foreign body nose, blow to the nose, cold and allergies, etc. cannot be ruled out just a bit. Sometimes the nosebleed in children can be idiopathic in origin as well. So how will you come to your diagnosis, Suman?
We should ask the history of nose picking, use of any anticoagulation therapy, use of prolonged face and mask ventilation, history of rhinitis, previous history of nose bleeding. Some hematological investigations should be done like complete blood count, prothrombin time, bleeding time, and hemoglobin concentration. Radiological investigations like X-ray, CT scan should be done to rule out any fractures, trauma, or foreign body. So, what is your diagnosis, Sarbin?
So there was fracture of nasal septum seen on X-ray and confirmed on CT scan. Prothrombin time, bleeding time were normal with no previous history of bleeding disorders. There was no history of recent rhinitis and anticoagulation therapy. So on the basis of history, examination, and investigation, it might be a case of trauma endoepistasis. So epistasis simply means bleeding from the nose. In more severe cases, blood may come out of both nostrils. Risk factors include trauma, inducing putting the finger in the nose, blood thinners, high blood pressure, alcoholism, seasonal allergies, dry weather, and inhaled corticosteroids. There are two types, anterior, which is more common, and posterior, which is less common but more serious. Anterior nosebleeds generally occur from glacial back plexus, while posterior bleeds generally occur from the sphenopalatine artery. Glacial back plexus is a vascular network of 4 arteries that supply the nasal septum. The arteries anastomose to form the plexus, which is a common site of nosebleed. It lies in the anterior inferior part of septum known as Little's area and Classelbach's area or Classelbach's triangle. The arteries are anterior ethmoidal artery, sphenopalatine artery, quadripalatine artery, and septal branch of superior labile artery.
Nosebleeds in the children can be caused by many things. Some common causes include dry air, picking the nose, blowing the nose too hard, injury to the nose, colds and allergies, objects in the nose. A child may be more at risk for nosebleeds if he or she lives in a dry climate, picks his or her nose, has allergies, has a cold. Some causes of recurrent epistaxis in the children are allergic rhinitis, retained nasal foreign body, use of the nasal spray as intranasal steroid sprays, hemorrhagic diseases such as idiopathic thrombocytic purpura, von Willebrand disease, vascular abnormalities such as arteriovenous malformations, hemangioma, angiofibromas, nasal parasitosis or nasal mycosis.
Some modalities of treatment may include first aid. Most of the time, bleeding occurs from the Little's area and can be easily controlled by pinching the nose with thumb and index finger for about 5 minutes. It is also called Trottel's method. This compresses the vessels of Little's area. Cold compresses should be applied to nose to cause reflex vasoconstriction.
Cauterization. This is useful in anterior epistaxis when the bleeding point has been located. The area is first topically anesthetized and the bleeding point cauterized with a bit of silver nitrate or coagulated with electrocautery. Endoscopic cauterization. Using topical or general anesthesia, bleeding point is localized with a rigid endoscope. It is then cauterized with a malleable unipolar suction cautery or a bipolar cautery. The procedure is effective with less morbid and decreased hospital stay. The procedure has a limitation when profuse bleeding does not permit localization of the bleeding point.
Another method may be anterior nasal packing. If bleeding continues, nose should be packed with a ribbon gauze soaked in neosporin antiseptic cream for 24 to 48 hours. Merocell packs can be used as an alternative to ribbon gauze packing, although costly but gives less discomfort to the patient. A balloon tamponade may be used as an alternative to nasal packing. It is less traumatic. If bleeding does not stop by anterior nasal packing, it indicates posterior bleeding, and posterior nasal packing should be done. Posterior nasal packing can cause cardiovascular complications like pulmonary hypertension and cor pulmonale since it leads to sleep apnea.
In case of persistence or recurrent bleeds from the septum, just elevation of mucopericardial flap and then repositioning it back helps to cause fibrosis and constrict the blood vessels. Submucosal resections operation can be done to achieve the same results or remove any septal spur, which is sometimes the cause of the epistaxis.
So if the bleeding is still uncontrollable, then vessel ligation according to the location of bleeding is done. External carotid artery, maxillary artery, sphenopalatine artery, anterior and posterior ethmoidal artery are ligated. In this episode, we discussed the case of nasal bleeding in child. Thank you for listening patiently. Don't forget to like, comment, share and subscribe. We will be back with another episode. Until then, have a good time.